Good evening, Dr. Arif. Sir, good evening.
Good evening, sir. Good evening, sir.
Good evening. Good evening. Good evening to all.
Good evening, sir. Namaste, sir. Namaste. ಆರಾಮಿದ್ದೀರಿ sir?
ಕರೆಗಣ್ಣವ್ರೆ ನಮಸ್ಕಾರ.
ನಮಸ್ತೆ ಸರ್. ನಮಸ್ತೆ. ಆರಾಮಿದ್ದೀರಿ ಸರ್?
ಏನು ನಿಮ್ದು ವಿಡಿಯೋನೇ ಇಲ್ಲಲ್ಲ?
ಸರ್ ಟ್ರೈ ಮಾಡ್ತೀವಿ ಸರ್. ಆಮೇಲೆ
ಓಕೆ ನೋ ಪ್ರಾಬ್ಲಮ್. ಓಕೆ ಎಸ್. ಅಣ್ಣಪ್ಪ ಪಾಂಗಿ.
Annappa Pangi, sir. Good evening.
ಅನ್ನದಾನ ಮೇಟಿ ಅವ್ರು ಬಂದಿಲ್ಲ ಸರ್?
ಮೇಟಿಯರ್ಗೂ ಹೇಳಿದ್ರಿ ಸರ್. ಒಂದ್ ಮಾತು ಇನ್ನೊಮ್ಮೆ ನಾನು ಐ ವಿಲ್ ಟ್ರೈ ಸರ್.
ಓಕೆ.
Just 2 minutes, sir.
Yes, no problem. Pangi joined. Hello, partner.
Sir.
Good evening. Unmute, Pangi. ನಮ್ಮ ಸೆಕ್ರೆಟರಿ ಬಂದಾರಲ್ಲ ಕರ್ಣಕರ್ ಸರ್?
Good evening, everyone. Hello. कैसे हैं?
ಹಲೋ
Hello.
ಹಾ ಹೇಳಿ
Hello.
ಸರ್ ಸ್ಟಾರ್ಟ್ ಮಾಡೋಣ ಸರ್.
ಕೇಳಿಸ್ತೈತೆ ಹೇಳಿ ಸರ್.
ಸರ್.
ಓಕೆ ಸ್ಟಾರ್ಟ್ ಮಾಡಿ.
ಸ್ಟಾರ್ಟ್ ಮಾಡೋಣ ಸರ್, ಸ್ಟಾರ್ಟ್ ಮಾಡೋಣ.
ಓಕೆ ನೋ ಪ್ರಾಬ್ಲಮ್.
Hello, sir. I'm not audible. Hello, am I audible?
Yes, sir. You are audible, sir. Arvind, sir. Arvind, sir.
Sir, you're audible, sir. Audible, sir. Proceed, sir.
Yes, sir. Yeah, Andre, Suresh, sir, I think net is little slow, sir. You can start.
Howda? Okay. Yes. A very good evening to all of you. I welcome all the
Hello.
members. Hello. Suresh, sir. Suresh, sir. Hello. Hello.
Sir, ಕೇಳಿಸ್ತಾ sir. Can you hear us?
Okay.
You are
John
audible.
idara?
You are audible, sir.
ಓಕೆ
I
ಕಾಗಲ್ಕರ್
think my voice.
Suresh, sir,
I'm not
start ಮಾಡಿ sir.
audible.
Suresh, sir, start ಮಾಡಿ.
Okay. Good evening, everyone. Myself, I am Dr. Suresh Kagalkar. I'm a convener of public health program. This public health program, we are going to start today is the first program in this forum under the banner of IMAKSB. Once again, I thanks to the organizer who has given me opportunity to conduct. This is the first program which we are going to conduct. So what we decided that every month, the first Friday is going to become our public health program. This time, because of short time, we have arranged today, that is the Friday. We have got the famous government, our person who is well versed with the certain outbreak and tropical diseases. Initially, we and a different COVID strain that right now it was diluted, and after that we decided that something different topic will take so that the public, especially the school children, the teachers, and the other the society people will be watching, and they will be interested and they will take part in our program. So that with that intention, we have got a certain endemic diseases, especially the tropical disease like a leptospirosis, which we have chosen in the under the banner of public health program. We have got a prominent the speaker, Dr. Srinivas SR, who is working in the public health, especially the health and family welfare. I welcome you, sir, for today's program. And with this introduction, I will hand over to our president, Dr. Karnagan, sir. Sir, I'll hand over to you, sir. Sir, next to proceed, sir.
Sir, thank you, sir.
Sir.
A very good evening to all of you. I welcome for today's first public health forum. I welcome our state president, Dr. Shivakumar Lakkol, sir. Welcome you, sir.
ಥ್ಯಾಂಕ್ ಯು.
And I welcome our honorary secretary, IMAKSB, Dr. Karnakar BP. Welcome you, sir. And I welcome the treasurer, Dr. Vijay Sarthi, IMAKSB. Welcome you, sir. And today's main person, the guest speaker, Dr. Srinivas SR, sir. Sir is a state epidemiologist, health and family welfare department. Welcome you, sir.
Thank you, sir. Thank
We
you.
thank you for spending your valuable time with sir. Thank you so much, sir, for accepting our invitation.
Thank you, sir.
Thank you so much, sir. And I welcome Dr. Suresh, sir, the main pillar of this program and conveyor public health forum. Welcome, Suresh, sir.
Thank you, sir. Thank you, sir.
And I welcome all the members of public health department and all the delegates for today's guest lecture. Welcome you all. Thank you, sir. Go to Suresh, sir.
On to the next the program, that is IMA prayer, which will be delivered by our beloved the secretary of IMAKSB, Dr. Karnakar, sir. Karnakar, sir.
Sir, Karnakar, sir, is not there, sir. You You can go ahead, sir. Okay.
Hello.
Okay, sir. Now we'll move to the next, the president talk.
No. You
Our
have to go.
Shukumar
Ah,
Lakul, sir.
No.
Sir, please, sir.
I'll go through this.
Suresh sir, Lakul sir is there. Lakul sir will read.
No, I will read.
Yes.
ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಪ್ರಾರ್ಥನೆ, ಎಲ್ಲರೂ
Sir.
ಸಂತೋಷವಾಗಿರಲಿ, ಎಲ್ಲರೂ ಆರೋಗ್ಯವಾಗಿರಲಿ. Can you hear me?
Sir.
Yes, sir. Yes, sir.
ಎಲ್ಲರೂ ಸಂತೋಷವಾಗಿರಲಿ, ಎಲ್ಲರೂ ಆರೋಗ್ಯವಾಗಿರಲಿ, ಎಲ್ಲರೂ ನೋವಿನಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲರೂ ದುಃಖದಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲ ಆಶೆ ಆಮಿಷಗಳನ್ನು ಮೀರಿ ಗುಣಪಡಿಸುವರು ನಾವಾಗಿರಲಿ. ಜೈ ಹಿಂದ್. Long live IMA. Good evening to all. I myself, Dr. Shukumar B. Lakul, President of IMAKSB. It is my honor to invite you all on this occasion. For the first time, we are conducting this meeting on behalf of public health in association with our IMAKSB. I welcome all the esteemed guests of this evening, Dr. Srinivas SR, State Entomologist and Health, Family Welfare of Government of Karnataka, and moderator Dr. Ashwini Kulkarni, Associate Professor of Ramaya Medical College. Our Secretary Karnakaran, Treasurer Vijay Sarathi, and President-elect Srinivas S, and also Convener Suresh Kagalkar, and Chairman of the Public Health Committee, Subcommittee, Arvind Karegannaur. This is a very good, and daily we are facing a lot of problem with this leptospirosis topic. Is very important for us. Every day we are facing this problem. The bacteria that causes a leptospirosis are spread through the urine of infected animals. Those animals are cattle, pigs, horses, dogs, and rodents, wild animals. These animals which are infected, they passes this infected animal, the contact with the urine, the fluids or saliva from the infected animal, contact with the water, soil and food contamination, urine of the infected animal, we are going to get this infection. I don't want to tell anything about in detail. There are so many renowned speakers like SR Srinivas is there, State Entomologist and moderator Dr. Ashwini Kulkarni. I welcome you. I handed over my mic to Dr. Suresh Kagalkar, convener, and also Arvind Karegannaur to carry out the next proceedings. Thank you, one and all.
Thank you very much, sir. Now we'll move on to the important topic that is the which is a tropical disease, especially in the endemic areas, the Kerala and other surrounding regions of the Karnataka region, and also in UP. It is very common. So we want certain etiology, etiopathogenesis, treatment and prevention, as well as the curative treatment regarding the endemic disease like leptospirosis. Now we have got our own the working person, a famous epidemiologist working in the health and family welfare person, Dr. Srinivas SR, sir. So I welcome you, sir. And sir is working in the Department of Health and Family Welfare as an epidemiologist. And sir will going to give a talk like leptospirosis. And this today's session is chaired by our person, the Associate Professor, the Department of Medicine, Dr. Ashwini Kulkarni, who is a physician and who is well versed with certain diseases, like especially tropical diseases. And he's going to narrate about the treatment aspect of the leptospirosis. Sir, welcome you, sir. Dr. Ashwini Kulkarni, sir, for today's function.
Welcome you, sir. Welcome, sir. Thank you, sir.
Now we'll move on to the topic per se, that is a leptospirosis. Now I'll give to Dr. Ashwini Kulkarni, who will moderate the session and conduct the program. Ashwini Kulkarni, sir.
Yes, sir. Yes. Yeah. Yes.
Okay.
Thank you, sir, and good evening to all the members and audience. So today we are here for a very enlightening talk regarding leptospirosis. It is one of the disease which is very mystical disease. We can tell there are a lot of differential diagnosis. Many times it happens that even though we are knowing about the disease, we get confused and we often miss the diagnosis also. So it is a common disease in the tropical countries, in the endemic zones. It is a zoonotic disease. So we all will learn more about this disease from our eminent expert on this field, epidemiologist, Dr. Srinivas sir. We are lucky to have you here. So now I request Srinivas sir to start his session. And then at the end of the session, we will discuss regarding questions, doubts, and the treatment strategies. Thank you, sir.
Thank you, sir. Thank you. Thank you, sir. Thank you for your eloquent introduction, sir. Actually, I'll just. Is the screen visible, sir?
Yes, sir. It's visible, sir.
Yes, sir. You can just make full screen and start.
Yes, sir. Visible.
Sir, to start with, when I was contacted regarding this, I must be very frank. Actually, our members actually asked me something about COVID-19 surveillance. Actually, the place I work in is the State Surveillance Unit, Karnataka State Surveillance Unit. We have, as you must all be knowing, we have a program called IDSP, Integrated Disease Surveillance Program. Under that, we have the State Surveillance Unit. We usually have, coordination with the Central Surveillance Unit, that is the NCDC in Delhi. So, sir was asking me particularly to give a small presentation on COVID surveillance. On my part, actually, recently for the past, I think 2 months, we were into this leptospirosis surveillance actually. To tell you more in detail, there were unlikely a lot of cases reported from Uttar Kannada, Dakshin Kannada, and very rarely, to be frank again, very rarely we can see in the interior Karnataka regions, which I think in our place will not be very rarely seen. Like sir, doctor told our physician, there is a lot of differential diagnosis where people might miss the cases. Even in my career, when I used to work as a clinician in a taluk hospital, I have come across very few cases of leptospirosis, after which I actually changed over to the public health aspect, where I got myself involved in surveillance, and I was posted as the state epidemiologist here. To continue my presentation, sir, anyhow, we'll start off. This is, as we all know, we have prevention and control of leptospirosis. We'll start our things like, we'll see what is the some introduction and positive agents, some risk factors, what is the mode of transmission which we study, is there any seasonal variation or something like that, any high risk groups we can think of, the case definition, which is more important for us, as surveillance officers. Like we are epidemiologists, or we are interested in case definitions. That is why we'll put up something like this. And of course, something about lab diagnosis, and we'll see how we can prevent and control. Detailed treatment aspect I could not come up with, I'll be frank, because the whole day I was preparing for actually a COVID roundtable meeting was held here in Bangalore, IAS Officers Club. Some of our senior IAS officers wanted to have something about this, and I had to go there. Anyway, our physician is here who can highlight us about detailed treatment aspects, sir. If we can come to an introduction, like your president told us, it's primarily a disease of animals, a zoonotic disease, and as we all know, it is caused by a spirochete of genus Leptospira. Like most important of those two species, like we can think of, is Leptospira interrogans and Leptospira biflexa. Microbiology wise, we say that biflexa is more common. It's saprophytic and very rarely causes infections among humans. Now, hosts include rodent and both rodent and non-rodent. That is cattle, buffaloes, goats, sheep, not just rodents like rats and all those things, bandicoots and all those things. Of course, cattle, buffaloes, goat also harvest these, harbor these bacteria actually. Both these rodents and non-rodents, that is cattle, excrete the large number of bacteria in their urine, through which they contaminate the soil and small and large water bodies, of course. And that is how a man gets infected when he comes in contact with water bodies, either he can consume it without proper filtration or proper procedures, or if he takes a swim and there is infection when he's got some injuries in his on his body, he'll get infected from the contaminated water. If we can look at the epidemiology as such, sir, leptospira is reported in a large number of countries. Southeast Asia region. We ourselves as a state surveillance unit, we are in contact coordination with the central surveillance unit and the WHO. That is why we use this language. If you all know, there is a WHO CRO. India comes in the WHO CRO region. That is the Southeast Asia Regional Organization region. India is in that region. So human cases have been reported from India, Indonesia, Thailand, and Sri Lanka, sir. Many outbreaks in India as such are from Gujarat, Maharashtra, Kerala, Tamil Nadu, Andhra, and Karnataka also. If you look at the government's initiatives, sir, initially, actually, compared to other national programs, a pilot project was approved in the 11th fire plan sometime in 2008 to 12, that is, if I am correct. And it was later approved as a full-fledged program in 12th fire plan, sir. That is post 2012. In India, currently, it is in endemic states like Gujarat, Maharashtra, Karnataka, Kerala, Tamil Nadu, and the Andaman. In Karnataka, actually, endemic districts are like Uttar Kannada, all in the coastal regions, sir. Uttar Kannada, Udupi, Dakshin Kannada, a small part of Kodagu also, like one case has been reported. I think last year, very few cases get reported. But coastal districts, even now, it's a wide problem in Mangalore and Dakshin Kannada and Udupi, which is why we frequently have leptospirosis awareness initiatives going on in Udupi and Dakshin Kannada. It is much of a problem. Usually, mortality is more in these two districts, actually. And a lot of IEC, or rather, public awareness programs are being held by even by IMA in these two districts, actually. Risk factors, if we can think of, usually, as I said, it is in the post-monsoon region when there is drainage, congestion, waterlogging, when there is heavy rainfall. After heavy rainfall, once there is waterlogging, which might cause all these water bodies to get contaminated. Another factor which the epidemiology says is the salinity of soil, which is favorable for survival of the bacteria. And one more theory given is the lower base saturation and mean soil temperature. That is also favorable during the post-monsoon period for the bacteria's growth. Modes of transmission. This is what we basically are worried about, sir. The contact of contaminated water, urine of rodents and non-rodents also, as I mentioned earlier, with abraded skin and mucous membrane. When there is an injury on the skin, an exposed skin to the contaminated water can transmit the bacterial infections. Leptospiral infections occur most frequently in persons between 20 to 45 age group. That is what that is the working age group as such. Those who work in the fields or maybe in animal products, who deal with animal products, transportation, and all those people, usually in that age group, the working age group usually are more prone to get infected, sir. It rarely occurs in young children and infants because of possibility of minimal exposure, as I told you. Epidemiology usually says there is a seasonal variation, sir. Usually starts with the onset of rainy season and declines. Of course, there are sporadic regions throughout the cases throughout the year, as we can document, sir. In our what we say IDSP program, we document yearly cases. If we analyze the occurrence of cases, will actually see to it that though there is crowding of cases during the rainy season and the post-rainy season, apart from those two seasons, we get sporadic cases throughout the year also. In India, like as I mentioned, it's been found more commonly with the post-monsoon. And of course, whenever there are some natural disasters such as floods, it might have an epidemic potential. This is what we are worried about. Luckily, for the past 2 or 3 years, we have not had epidemics for leptospirosis, which once occur sometimes some 3 or 4 cases. As I remember, we had got in some small, I think somewhere in Karkala or someplace, we had in some hostel, we had some 4 or 5 children who had leptospira. That is the last outbreaks that I can recall, sir. Recently, we do not have, but of course, we have actually kept our vigil. And to actually tell you the truth, actually now there is improved reporting of cases, sir, actually. Because previously, if most of you are in the private sector, you will know that now we from the government have asked you to take a login for IHIP. We'll discuss this after the this presentation, sir. So we get increased reporting of cases on our IHIP portal. The high risk groups who are more prone to get infected, as I told you earlier, sir, agricultural workers, like who might be working in a rice field planter, sugarcane fields, pineapple fields, and all those agricultural workers involved, sir. Other high risk groups in among occupational, if you can think of, are fishermen, sewer workers, and all those persons who are liable to work in rodent infested environments, sir. Incubation period, coming to incubation period, documented incubation period is anywhere between 5 to 14 days, sir. Range is between 2 to 30 days. We as epidemiologists, what we are concerned of is the case fatality rate, which is around 0 to 15%, so somewhere. Well treated cases of generally have a lesser CFR, as we say. If you look at the spectrum of illness, sir, most of the this disease is usually anicteric, like mildly symptomatic. If we classify cases as such on an epidemiological basis, we say one is anicteric leptospirosis, another one is icteric leptospirosis, and the last one is severe leptospirosis. This is how we consider cases as such. Case definition, like I was telling, why we are involved in case definition is because we are I am an epidemiologist and I consider all cases coming in with symptomatically the same symptoms as leptospirosis, which I can gather more cases as such. Suspected, a suspected case of leptospirosis, as I say, as the documented history says, acute febrile illness with body ache, I mean myalgia, headache, associated with a history of exposure to an infected animal or environment contaminated with animal urine, and one or more of the following signs, sir. It might be calf muscle tenderness, conjunctival suffusion, anuria, oliguria also, sir, proteinuria, jaundice, hemorrhagic manifestations, usually in the intestines and lungs, meningeal irritations, sir, nausea and vomiting, abdominal pain, diarrhea. Probable case, any suspected case, the first criteria, with a positive presumptive laboratory diagnosis. That is when we label a case as probable case. A confirmed case is when a suspected case or a probable case with a confirmatory laboratory test. That is what these are the three basic case definitions which we are worried about in our surveillance when we do surveillance for leptospirosis. Now, this is what we think of when it comes to lab diagnosis. There are different approaches, of course. One we can think of is culture, microscopy, as we know. Dark field microscopy is one. If we can, if everybody can recall our MBBS days or microbiologists, if there are some microbiologists, they might tell you that dark field microscopy, something like spirochete, right? Leptospirosis is spirochete, and of course, the favored microscopy technique is dark field microscopy. So there are other things like immunofluorescence, and of course, silver impregnation technique. Immunology, sir. Immunology is, of course, the newer variety of tests, ELISA, agglutination test, IgG test, the rapid test which we get off later, immunologic test. Sir. Molecular, as we all know, it is PCR. And of course, when you think of gold standard test, it is, of course, either PCR or, of course, isolation by culture. I told you the two criteria when we take the case definitions: a probable case, a suspect case, and a confirmed case. When we think of presumptive diagnosis, sir, it might be when we use a positive IgM which comes out from a sample, if there is slide agglutination technique also, immunochromatographic positive readings, or demonstration of leptospirosis by staining. Even that can be presumptive because there are a lot of differential diagnoses, and the spirocate might be something else also. Confirmatory, as I said, it can be isolation by culture, isolation of the bacteria, and by PCR, sir. This is what are confirmatory, which we consider to qualify as a positive case of leptospirosis. Of course, coming to prevention and control, this is what we are interested in from the government angle. Like the health education, we have a lot of ISC activity happening, sir, because our all our district health offices have something called as a district surveillance unit also, and a lot of educational activities also take place there. Every district, ideally from the government, has a health education officer also, who is involved in health education activities for the general public, sir. Chemoprophylaxis, this is what we also do, sir, from the department. During peak transmission type, when in endemic districts, our health workers usually distribute doxycycline 200 mg once in a week, which may be given to agricultural workers. And if there is a recorded outbreaks in a particular region, sir, and the surveillance shows lot of fever cases coming in, which might be suspected to be leptospirosis, we start giving chemoprophylaxis. So this is what we do from our department. Of course, rodent control, we coordinate with the veterinary division. If we can do, they can do something about this. From our end, we also map the water bodies in any village or a taluk level. After health education, mapping of water bodies, we usually spread awareness as to like this might be a cause of increase in number of cases. This is what we do, sir. And of course, vaccination of animals is one option which the WHO says in its document. But as far as India is concerned, sir, studies, veterinary people we have contacted tell that okay, they usually have to immunize the cattle every 6 months or maybe a year, and which will not be affordable, which the livestock, immunizing all the livestock is not affordable. This is what a frank opinion from all our veterinarians tells. Thank you, sir. This is what I had. Like as I said, I'm sorry I could not go in very detail regarding the treatment aspect. As a surveillance medical officer, as an epidemiologist in the state surveillance unit, I'm basically involved in collection of cases, surveying diseases, gathering as much cases as possible, sir, and triaging. This is what I'm involved in. Actually, I did talk to Dr. Reddy about the treatment aspect, since I thought that our moderator was a physician. Maybe he might be, sir. If I have the liberty of talking about this, sir, please, sir, can you?
Yes, sir.
Thank you, sir. Thank you very much, sir. Thank you, everybody. This is I got this opportunity. I am in fact thankful for everybody that you could call me to this. You could invite me to this your program, sir. Thank you. Thank you, sir.
Thank you, sir, for the wonderful presentation. It was very crisp, and you spoke very important aspects which all of us are interested to know about: the surveillance, the case, the definition, and you covered a lot of symptoms and signs and diagnosis. So as was told to me, I'll just share some of the treatment aspects and diagnosis of the leptospirosis. So as a clinical point of view, what I would like to tell to our speakers is the identification is very important. So what happens is clinically, since as sir mentioned in his slides that the most common symptoms are fever, body pain, myalgia, and all these things. So most of the time doctors get confused and they do not consider leptospirosis as one of the differential diagnoses. So most commonly thought about diseases are viral fever, dengue fever, sometimes malaria fever, and like that. And somehow the thinking goes around this aspect, and leptospirosis never comes into the thought. So what I would like to tell to the speakers that we have to consider leptospirosis is one of the important cause of acute febrile illness in the background of the history. Like if the patient's occupation is farmer, if he belongs to, works in fields, works in places where there is a lot of water clogging. So always this history is important. And also history of travel, especially when we are in Bangalore, in other parts of state and country where it is not endemic, we have to ask history of travel. Whenever they have traveled from these endemic states, we always have to consider leptospirosis is one of the important differential diagnosis. Unless and until we think about it, we will never ask for tests. And thereby we miss the important time from where the leptospira, which can be easily treated, goes into the severe phase where the patient survival becomes difficult. So first thing is epidemiology, where the patient has come from, travel history, endemic areas, and occupation. After this, few of the important clinical clues which we can consider is like what sir has mentioned in the slides. I just want to emphasize it further. Like whenever somebody has disproportionate conjunctival congestion, fever is there and eyes are red in color, there's a lot of conjunctival hyperemia. That is one of the very reliable sign that we have to test the patient for presence of leptospirosis. Second thing is severe calf tenderness. These patients tell that I have severe leg pain. So when such pain, that you won't get such pains in dengue fever also. So even though we tell dengue has severe body pains, but the calf pain is so severe in leptospirosis, that is one of the clinching diagnosis for us. Apart from these two signs, there is involvement of other organs like involvement of kidney. So whenever few days history of fever and creatinine is high, albuminuria is there is blood in the urine, we have to consider leptospirosis. Apart from that, as sir had mentioned, even involvement of liver enzymes go high, jaundice, so icterohemorrhagica, that is the word used. So whenever this constellation of symptoms is there, of fever, endemicity, conjunctival congestion, icterus, body pains, calf tenderness, involvement of liver and kidney, we have to think of leptospirosis. So once when the diagnosis of presumptive leptospirosis is made, we have to send the patient for the investigations. Sir mentioned very eloquently a lot of tests which are very good. But same thing as I mentioned in the clinical setting, we usually do immunological tests because of rapid results. We do IgM ELISA, which is good enough, has reliability, as isolation and culture takes some time. So we usually send for IgM ELISA, but in center where PCR is available, we can send for PCR for leptospirosis also. But at the same consider, once we have a clinical suspicion of leptospirosis, we have to initiate treatment. So treatment aspect, leptospira is an organism which is quite sensitive. So if you start good treatment initially, it is easily treatable. Only thing is when it goes into renal failure, liver failure, that time patients do not come back. So drug of choice traditionally is penicillin injections, but in many places still penicillin, the traditional one, may not be available. So we have to use doxycycline. So doxycycline has a very good effect on leptospirosis, usually in the dose of 100 mg twice a day. Usually we give in the injection forms. So along with that, we also use ceftriaxone. So leptospirosis is it has inherent sensitivity to ceftriaxone also. So generally in most of the settings, we use ceftriaxone along with doxycycline so that we cover the leptospira organism adequately. Once again, always make sure that the treatment, we have to monitor the liver and kidney and presence of any pulmonary syndrome, meningitis syndrome, which are the further complications. So we have to manage the renal complications well, proper hydrations, IV fluids, input-output charting. Sometimes the dialysis may be required. Liver functions need to be seen. We may have to use plasma infusion for if there is coagulopathy due to liver injury, and so on. And finally, the supportive care, blood transfusion, sometimes nutrition, all of things have to be taken care. So only thing I want to tell to the speakers is, if we have a clinical suspicion and we identify start that appropriate antibiotic treatment, leptospirosis does has a very good prognosis, but still the case fatality rate is around 0 to 15% as mentioned. Most of the time what we have seen is patient come to us at last stage when they already have extensive renal damage, extensive liver damage. That time the treatment becomes very difficult. So at the entry level itself, if the medicines are started adequately, then patients will not go to these higher levels. So this was in general regarding the treatment. There are some things what sir mentioned. Prophylaxis, doxycycline 200 mg weekly once is given for high risk people who work in the endemic areas, who have a travel plan to endemic areas sometimes. In pregnancy, the treatment is slightly different, where doxycycline cannot be used. That time we use azithromycin and ceftriaxone. So these are few of the clinical things. But once again, identification is the main thing in leptospirosis. I hope if any doubts are there for sir and me, anyone can unmute and talk to us. Thank you very much.
Thank you very much, sir. If I may add something,
Yes, sir,
sir,
please.
which I missed, I might have missed in my thing, because since I work in the department, government, we have certain government notified laboratories across the country which are specifically involved in leptospirosis screening, diagnosis, lab testing. In Karnataka, sir, one of the notified labs for leptospirosis is we have an institute called Nivedi.
Yes.
It is the National Institute of Veterinary Epidemiology and Disease Informatics.
Yes.
That is where, in case we suspect any outbreaks of leptospirosis, we send our samples. We'll see to it that the district surveillance unit collects samples and they are sent to Nivedi, sir, in Karnataka. Across the country, there are, if Delhi, it is the NCDC, Delhi, New Delhi. In Tamil Nadu, it is the, I think, National Institute of Epidemiology, Chennai.
Yes.
And of course, Madurai Medical College also has one, I think. So I'm some place in Uttar Pradesh also I can recall. I think the PGI, Chandigarh also maybe has some facility to test this. These are some of the notified institutes where we can test our samples are actually across India. This is where in Karnataka, as I told once again, it is the Nivedi which we coordinate for most of our zoonotic diseases surveillance. Sir. This is where we have a division called the zoonotic division. Of course, if I get an opportunity sometime to talk again, the government's initiative now regarding emerging and re-emerging zoonotic infections is something called as One Health. You must have heard something about this. If I get an opportunity, I can talk something about One Health again in your IMA forum, sir. Thank you, sir. Thank you. That will be from our side, sir. And one more extra thing which I had left out was I was talking about something called IHIP and increased reporting, which has been, of late we've been having increased reporting. Sir, IHIP is a portal. It is, integrated health information portal. If all of late, like since I think last month we have invited all private healthcare facilities also to be a part of reporting in IHIP, sir. That is, you can contact your district surveillance unit. There is someone called as a district surveillance officer who will give you a separate login for your healthcare facility, so that you can screen patients, you can survey patients, and you can upload cases which come in. The idea is to catch outbreaks early. This is what we are looking at, sir. So if you have a healthcare facility, sir, in your district, so I from the government side urge you to please contact the district surveillance unit, take and the login ID for your healthcare facility, and start reporting under the platform, sir. Thank you, sir. Thank you very much.
Sir, I had one doubt. If you are, sir, as per what do you suggest about the isolation of cases? Is it recommended as per your?
No, sir. We don't isolate cases, sir. We don't isolate.
Thank you. Thank you, sir, for the nice talk and also giving additional information about the hospitals and nodal centers.
Thank you, sir. Thank you.
If other audience have any doubts, they can unmute and ask. I think we have a question from Sir Appanna, sir. Sir, can you unmute and ask, sir? Hello, sir. Can you ask your doubt, sir? You have raised your hand. Annappa, sir, can you hear us?
Yeah, am I audible?
Yes, sir. Yes, sir. You're audible, sir.
Yeah. I just wanted to ask Dr. Kulkarni regarding the statistics of our state now. I mean, how many cases we had in the last 1 year?
Yes, sir. Srinivas, sir, you have any?
Sir.
Yes, sir.
So actually, the past 2022, we have reported 15 cases, sir.
Okay,
Actually,
sir. Right. Thank
actually,
you.
the recorded statistics are, they are confidential statistics of the government.
Okay.
Not told, but I can be free because the past year we have not had major outbreaks of leptospirosis. But of course, we had not, like earlier I had told you, we had not expected cases in Uttar Kannada, which we got last year. And of course, we got reported 2 deaths from interior districts also. One in Davangere and another one in Kalaburgi. This is what
Okay.
prompted us to extend our surveillance activities for leptospirosis in the interior regions also, sir. This is what. That's it, sir. That's it.
Okay. Thank you. Thank you so much.
Thank you, sir.
Thank you, sir, for the question. Any other questions?
Mute ಮಾಡಲಿ.
Suresh sir, there are no other questions, sir. Yes, sir. Suresh sir. Sir, I think you are mute, sir. You can unmute and ask the question. Sir. Suresh sir, I think you are muted yourself.
Sir, you are muted, sir. Please unmute and respond, sir.
Yeah.
Yes, sir. Now you are audible.
Hello.
Ah, sir, you are audible. Now
yeah. Now I'm. The one question, especially here in our many members are of pediatrician, especially Srinivas sir is there and Dr. Suresh Kudwa sir is there. With that regard, especially in the children, what is the treatment, sir? Ashwin sir, what is the treatment of this leptospirosis in children?
Yes, sir. Usually, leptospirosis, as I mentioned, the drug of choice is penicillin group and doxycycline. In pediatric group, usually doxycycline cannot be used. So penicillin groups are the drug of choice. So either penicillin or cephalosporins can be used. And even some studies have told azithromycin has a good role. But in most cases, ceftriaxone is preferred in the pediatric age group, sir.
Okay, sir. And one more question is that is there any vaccine available, because the person who is going in endemic, travel history is there?
Yeah.
Is there any, Srinivas sir?
Like as I told you, sir, vaccines are of limited help, sir. Like as I told you, it will require further vaccines. As such, the government has no plan of coming up with vaccination. So vaccination as such has been tried out in other WHO regions, sir, where endemicity has been recorded in the Southeast Asian regions like Indonesia and other areas, sir. But as such, with no the antibody levels were not up to the mark. This is what some studies have shown. So even in India, vaccination is not being considered by the government, sir. Thank you.
Thank you, sir. And now here with us, Dr. Suresh Kudwa, sir, who is a past president of IMAKSB. Sir, there is a Karkal, there is a one outbreak that was happened in the Karkal. Sir is from the Karkal place. Sir, will you throw some light, sir? Suresh Kudwa, sir. Kudwa, sir. Kudwa, sir, ಇಲ್ಲ sir. Okay. Dr. Srinivas, sir.
Sir, please.
Dr. Srinivas, sir. Hello. Dr. Suresh Kudwa, sir. Okay. Anybody wants to ask questions? It is open. And the question can be conveyed to the Srinivas sir as well as Dr. Ashok Kulkarni sir. So it was a nice topic, and we came to know the many important, especially the diseases which are endemic and commonly what we thought that early used to give as well as oxycycline, especially before diagnosis, and we wanted to know the different the disease protocol itself. So like that, any disease, sir, Srinivas sir, disease protocol. The endemic area, government has given a guideline regarding the disease, how we can diagnose and how we can trace the disease.
Sir, of course, as I told you, sir, the government started program for prevention and control of leptospirosis. It is a full-fledged program in the endemic districts. We have for our district health officers and our district surveillance units a fixed schedule of activities which our health department workers undertake throughout the year regarding prevention and control of leptospirosis. I think I can share a document from Government of India regarding prevention and control of leptospirosis. This document, I think it was launched after, like I told in my presentation, a full-fledged program was started for leptospirosis. I will share the document with you, sir. Maybe you can circulate it among the group here. I think I don't have it now. Sir?
It will be very helpful, sir.
Sure, sure. It is, I think, Government of India, NCDC, the National Center for Disease Control, came out with that document after the 12th five-year plan. I will share it with sir, so that maybe he can share it with the group again.
Okay, sir.
So as I told you, we have a fixed set of activities which are undertaken by our healthcare workers in those districts. One of those activities, which like I told you, will include post-monsoon, whenever there is increase in fever cases, they start distributing doxycycline as chemoprophylaxis. That is the activity undertaken by government, sir. Predominantly, we basically focus on other preventive activities like health education and all those things, sir. Thank you, sir. Thank you.
Thank you very much, sir. Thank you very much.
Sir, I have one question, sir. I have one question. So as of now, in what all districts are like officially told as endemic in Karnataka, sir, like where active surveillance is happening?
So Dakshin surveillance as such is happening in all the districts, sir. But our focus primarily is on Dakshin Kannada, Udupi, and parts of a few taluks of Uttar Kannada also, sir. Okay. Along the coastal regions, sir, where the lower ghats, which we say. Yes. And that is where our active surveillance usually happens, sir.
Okay, sir.
Most of our field activities are concentrated in Dakshin Kannada, Udupi, parts of Uttar Kannada.
Thank you, sir.
Thank you, sir. Thank you.
Any other
question is open? Yes, question is open to other member also. If anybody wants to ask question, feel free to ask question. Geeta Dopa madam is there, sir? Dr. Geeta Dopa madam, member of AMS. Prakash Basme, sir. Okay, if there is no question, thank you very much, Dr. Srinivas, sir.
Thank you, sir.
And also thank you, Dr. Kulkarni, sir, Ashwin Kulkarni, sir.
Thank you, sir.
You were giving a wonderful lecture, especially curative treatment. You have given such a nice that all the doctors and as a practitioner who are they are seeing all the fever cases. So it's one of the differential diagnosis, especially in the endemic area. And whenever we want to go to the different areas like Kerala and other surrounding regions, so it's important tips you have given, and also the treatment. So it is beneficial to all the IMA members, especially who are working in the periphery. So it's important. And also we'll touch with the government, especially surveillance officers guidelines. We will take their help as well as the tips. Frequently we will have a meeting along with the district health officer as well as surveillance officer. Okay. So we'll take the benefit. And with this brief, we'll end up the session by giving a vote of thanks. Sir, anything before giving vote of thanks? Arvind sir, you want to go add anything? Arvind sir,
Hello. Sir.
our president
Hello,
of the Public Health Forum.
Hello.
Hello. Yes, sir. Please, sir.
Yes, sir.
Please.
Sir, thank you, Suresh sir. It was a wonderful guest lecture today. I have to thank Srinivas sir for giving me enlightening all the members for about leptospirosis, sir. Thank you so much. And Ashwin Kulkarni sir, thank you for giving the treatment aspects and all. Thank you so much. And the discussion was very well. I thank Suresh sir. Is there any queries remaining, sir? Suresh sir, any queries
Thank
are
you,
there?
sir. Thank you, sir. Thank you very much.
Thank you very much. And recently we were there in the especially conference happened in the Karkala and the surrounding regions. Now we came to know near Karkala, which was outbreak. So by knowing that we were beneficial, so many members, especially the PSC, especially for the IMA branches are there nearer to the endemic regions. So it is very helpful and enlightened us the knowledge. Thank you very much, sir. Once again, on the behalf of IMAKSB, I thanks to Dr. Srinivas SR, sir. He is epidemiologist. In his busy schedule, he has given me opportunity. Sir, once again, welcome different platforms of the IMA in the next year also. Thank you, sir.
Thank you, sir.
And also, a thanks to Dr. Ashwin Kulkarni, sir, who is a professor in the medicine department of MS Ramaya Medical College, who has enlightened different the treatment aspect and he has carried out the curative treatment of the leptospirosis. Thank you very much, sir.
Thank you, sir.
Ashwin Kulkarni, sir.
Thank you.
Once again, we will meet you in the different of the our IMA KSB, Indian Medical Association.
Definitely, sir.
Thank you, sir.
Thank you very much.
Thank you, sir. Thank you. Thank you.
So I thanks to Dr. Shivkumar Lakkod, sir, who is the president of IMA KSB, who has given opportunity and who is under his leadership, we are doing a good job, especially public health and IMA AMS, public health. And recently under the leadership of Dr. Lakkod, sir, there was some letter written to the government regarding the internship course, NEET exam, which was postponed. It is a victory for us, especially all the members. It's a victory. So IMAKSB has done a good job under the leadership of Dr. Lakkod, sir. So congratulations, sir, and thank you for joining the today's program, sir. Lakkod, sir. So I thanks to our secretary, Dr. Karunakar, sir, and also I thanks to our treasurer, Dr. Vijay Sarthi, sir. And I thanks to Annappa Pange, sir, Prakash Basme, sir, and Geeta Dappa, madam, and all the members who have joined the program. I thanks to everyone, and the program is very successful. And I thanks to our president, chairman of this public health program, Arvind Karinaganamar, sir, who has given me opportunity to conduct this first program. We'll meet you in the such programs will conduct in the every month. First Friday in the evening 8 p.m. So I thanks to everyone. I thanks to John, who has given me opportunity and he has done a fly card very neatly and it was successful. And I thanks to everyone who has attended this program.
Thank you, sir.
Thank you, sir.
I will make a good night. Sir,
Thank
good
you.
night, sir.
Good
Thank
night.
you and all.
Thank you. Thank you.
Thank you.
Thank you, sir.